In this video, we will talk about some of the physiological differences between males and females, apart from the obvious ones. And I will say I did a TED Talk on this, on sex and gender, and how physiologically we're much more different, males and females, than we think we are, and psychologically, emotionally, probably more similar. So I encourage you to watch it and say nice things. Don't say anything if you don't want to say something nice. So if you just Google TEDx, FGCU, and Martha Rosenthal, it's called Gender Agenda. You should be able to find it. So gender and sex. It's always the discussion, is it nature or nurture? And the answer is always it's both. In this video, we're going to talk about the physiological differences, and we tend to underestimate these differences. For gender and behavioral, we overestimate those, but that's in the TED Talk. Now, most medical research is done on males. Even things like the pill, the birth control pill, was first tested on males. Drugs that women use more than men are tested on women. Now, there's been a drive to change that in recent years, which is good, but still more is done on males, and some of the reason is they don't want to test anything. What if you're pregnant? They don't want to test an untried drug on somebody who is pregnant. And they also don't want to deal with messy menstrual cycles. But remember, men have cycles too. We learned that. But so we still consider the average human being to be a 20-year-old male, and most research is done on males. All right, next question for you. Who is stronger, men or women, males or females? And don't try and be PC, and you might have just thought men. Men do tend to have better upper body strength. Not all men do, but women, we have strong legs. Use your legs. But what does strength mean? If we look at mortality, male mortality is higher at every single stage of life. So fetuses, there's 120. Oh, here's the trivia. It's a trivia. All right. Hooray. Here's a trivia question. More male fetuses are conceived than female fetuses. There's 120 males conceived for every 100 females conceived. But then only 105 males are born for every 100 females born, which means that male embryos and fetuses are much more likely to be miscarried than female embryos and fetuses. So fetal stage, females are stronger. Newborns, males are at a greater risk for cerebral palsy, more likely to be premature, more likely to be born dead, more developmental disorders, more X-linked disorders, more Tourette's, hyperactivity, more autism, more hemophilia, more muscular dystrophy. And in adults, males have higher rates of diabetes, alcoholism, ulcers, lung cancers, and more likely to die by accident and suicide. So male mortality is higher at every stage of life. So let's look at different organ systems and the physiological differences between males and females. Cardiovascular. Females have a faster heartbeat and lower blood pressure, and males carry more oxygen. We know that. Their hungry skeletal muscle needs it. And males and females have different heart attack symptoms, and this is clinically really important. The classic sign of a heart attack is pain in the left arm and maybe in the jaw. That is much more likely to happen in men. Women are more likely to feel some nausea, some indigestion, maybe feels like heartburn, maybe feel a little dizzy, and it's hard to breathe with them as well. But so the guy shows up in the ER and his chest, it's a crushing pain in his chest and his left arm hurts, and he's treated immediately and aggressively for a heart attack. A woman shows up and she feels like, oh, I'm a little nauseated, I feel like I have heartburn, I got a pain in my shoulder, and she is having a heart attack, but she's given antacids and sent home. So it's really important to recognize these symptoms. And even when a woman comes in with the classic hard to breathe, pain in the chest, and down the left arm, they're still more likely to think that she's just being emotional, still more likely to excuse it away, and believe a man is having a heart attack and say the woman is, I don't know, she has her period or she had a fight with her hubby or whatever, that she's just being emotional. Even when the tests show, no, she's having a heart attack, women are treated less aggressively. And for these reasons, Women are twice as likely to die after an MI, after a heart attack, less likely to be admitted to the hospital. They get less aggressive treatment. Uh, Women are also older when they have heart attacks. That may play a role, but we need to learn to recognize the different signs and symptoms in men and women. Skin is different in males and females. Females have thinner skin, less prone to acne, because DHT does that, sweat less, but they sweat more effectively. And women, as we know, have more adipose. Our bones and joints are different. Men have a higher bone density. And women athletes are more prone to knee injuries because the way the ligaments cross as they come from our wider hips for the birth canal, they cross differently over the knee, and knees are more likely to pop out and you're more likely to get ligament damage. What else? Oh, contrast. This isn't your notes, but one of these is male, one of these is female. So I'm going to point to one and say it out loud. Go ahead, talk to your computer. Which one is this? Oh dear. Probably most of you said this is female and this is male. They're both the same person. All they did was play with the contrast. We expect to see more contrast on female faces, and makeup accentuates that. All right, let's go to the physiological differences. Digestion. Food moves more slowly through digestive tract in women. Males secrete more stomach acid, and females have more cholesterol in their bile. Metabolism. Men have a higher metabolism. They have a higher metabolic rate. It is easier for men to lose weight and to keep it off. And there's a whole bunch of reasons for that. There is nature and nurture. So nature. Males tend to have more skeletal muscle. Skeletal muscle is hungry tissue. It burns a lot of calories. A pound of skeletal muscle burns 6 times more calories than a pound of fat. So weight training is good for everybody. So everyone should do a little bit of weight training. But males just burn more calories because skeletal muscle, of which most men have more, burns more calories. Males and females tend to have different fat. When guys put on weight, it's more often to have a belly. Females are more likely to have butts and thighs and hips. And it's actually different fat. The butt and thigh fat is better. It's healthier. Belly fat is much more dangerous. That gets into your blood vessels easier. It's more dangerous. But hip and thigh and butt fat is hardest to lose. Let's see, brain chemistry. Men after a weight loss have more of a hormone called leptin. Leptin is released from your fat and it goes to your brain and it says, stop eating, you have too much fat. Men have more leptin after weight loss, so they're getting more of a signal saying, I'm not hungry, I don't want anything. Women don't get that. So after losing weight, women's brains are saying, I'm hungry, I'm hungry. Men's are saying, nah, not hungry. Also, a trivia question. The evolutionary reality is that females give birth and it takes calories, it takes energy to create life. It takes between 80 and 88,000 calories to maintain a pregnancy. And that's about 25 pounds of fat. Now, when a female body has less than 25 pounds of fat on it, often her period will stop because the body says, I don't have enough reserves to carry a pregnancy to term. And the body fights very hard to keep that fat on in females. So those are all nature reasons, all biological reasons, but nurture plays a role as well. So I like this one. Women are more likely to go on diets. Women are more likely to look at themselves and say, oh no, I look terrible. And men, think they're studs. I'm generalizing, but women are more likely at any one time to be on a diet. And anytime you go on a low calorie diet, do not do that. Don't go below 1,200 calories. Because when you eat 900, 1,000 calories a day, that is going to permanently raise a hormone called ghrelin. And ghrelin increases your appetite and stops you from burning calories. So I think because society says women should be small, although it's changing, thick is it. So because society in the past certainly said that women should be small, women are more likely to go on very low starvation diets and permanently change their bodies. Alrighty. Drug metabolism. Males and females deal with drugs differently. Our bodies deal with it. Females have less of an enzyme called alcohol dehydrogenase, which breaks down alcohol. So everything else being equal, a 150-pound man and a 150-pound woman drink the exact same amount, the woman's getting more drunk. She has less of the enzyme that breaks down alcohol. Everything being equal, men and women smoke the same number of cigarettes. Women are more sensitive to the carcinogenic effects. So more men smoke cigarettes, but women, that's really going up in women, and women are more likely to get lung cancer from the cigarettes they smoke. Let's see. Aspirin. A low dose of aspirin in men is thought to reduce heart attacks. Actually, they've stopped people from doing that because it really has no clinical significance. But it doesn't do that in women. In women, it decreases stroke. We don't know why. Men are more sensitive to speed, to amphetamines and caffeine than females are. So there's a lot of differences. In cannabis, women develop tolerance more. So many, many drugs males and females respond differently to. Other physiological differences. Hearing. Females have a greater sensitivity for sound in general, especially for high tones. It might be evolutionary that women need to hear a higher frequency of the baby crying. Who knows? Olfaction, women have a stronger sense of smell. And vision differences. Females see better in the dark, have better visual memory, better peripheral vision, but males see better in bright light, have better fovea, straight on vision. And females tend to see faces better and more colors, but men see movement better. Oh, I had those all there. Okay. So you can pause and write that down if you want. I won't ask on the specifics. Let's see. Concussion. Ouch. All right. Concussion affects women more adversely. They have more severe symptoms. They recover more slowly, especially if they're injured in the 2 weeks before their period. So that seems to be hormonally caused, this more adverse effects. Progesterone seems to make concussions worse. So if you're premenstrual, when your progesterone is high, the effects of a concussion seem to be worse in females. Pain. Who is more sensitive to pain, men or women? Say your answer out loud. All right, it's actually women. I bet a lot of you thought men. Men complain more. This is shown. Men actually complain more, but women feel more pain. They have a lower threshold. So they test pain in a laboratory by having you stick your arm in an ice bucket and hold it there. They can't stab you. They can't do that. So they have to do something that's not going to cause damage. So usually they test it with ice. But women are also more sensitive to cold than men are. But women report pain with less stimuli. They feel it longer. They tolerate it less well. This to me is not fair. Think of this, later in this section, we'll talk about the cervix and how big it is. And at rest, it's about the diameter of a drinking straw. That has to open up enough for a human being to come out of the vagina. And that hurts. So you would think evolutionarily it'd be nice if women didn't feel as much pain, but no, women actually feel more pain. But men are more likely to ask for and receive pain medications. When women who are actually in more pain ask for morphine to relieve their pain, women are more likely to be thought to be complaining and are less likely to get pain meds from their doctors. Now, pain, as there's so many things, nature and nurture plays a role. Strong nature. There's genetic, cellular, anatomical, and hormonal differences explaining why males and females have a different response to pain. Males release more endorphins with pain. They have a different in their periaqueductal gray. So a lot of biological reasons. But nurture plays a role as well. We're kind of conditioned. We learn our response to pain. So think of it this way. If you've ever interacted with a toddler who's toddling around and they fall on their butt, they look at you to see your reaction. And if you're like, oh no, oh baby, they cry. But if you're like, ha ha ha, let's get up and play more, they get up and play some more. So we learn our response to pain. So think how we treat a 7-year-old boy and a 7-year-old girl playing in a tree. The boy falls out of the tree and we're like, suck it up, be a man, don't cry, which is, we're hard on boys and men in this society. We don't treat them fairly. We don't treat females fairly in different ways. To little girls who fall out of the tree, we're more likely to say, oh, don't climb trees, go play with your easy bake oven. And we learn that. And so some of it is we're conditioned maybe females to express our pain. We also allow females to express sadness and fear, not anger. Men can express anger, women are not allowed to. And finally, there's environmental factors that affect this. Whether you have a male or female physician will affect how you're responding to pain. Men who have an attractive female physician are more likely to say, oh, it doesn't hurt. You know, they're bleeding out their eyes, but they're like, nope, nope, I'm fine, I'm strong. So a lot of things go into your perception of pain. And almost closing it out, brains. Males have larger brains, more cerebrospinal fluid. Parietal lobe and amygdala tend to be larger. Parietal lobe is spatial relationships, amygdala, rage and fear. And prenatal testosterone does tend to increase the growth of the right hemisphere over left hemisphere. Females tend to be smaller, but proportionately larger compared to body size. I mean, most males tend to be larger than your average female. So when you adjust for that, just actually females have slightly larger brains. They have more blood flow. And what's bigger in women is the frontal lobe, the hippocampus for memory, Wernicke's and Brokaw's area. Those are language areas. And anterior commissure, that's for sense of smell. We think that females are less lateralized, so less likely to be just left or right brain and use both sides more. Corpus callosum might be different, but probably not. But this is important. How much of these differences that we've measured in 40-year-old men and women, how much of it is nature and how much is nurture? Because we live in a gendered world. And if you're born a boy, they put you in blue and they give you Legos and they have you throw balls into hoops. And if you're a girl, they put you in pink and they give you jewelry making kits and dollies. And what you play with and how you interact with people and what they encourage you to do changes your brain. And so it's really hard to say how much of these differences are natural. And I believe there are some differences. Testosterone and estrogen affect your whole body. Why not the brain? But I do believe most of the differences they see at age 40 might not be there in an infant. And I'll close out with the idea of neurosexism. We use neuroscience to support our pre-existing ideas about the differences between men and women. And we like to say that, oh, we're just born so differently. The men are from Mars and women are from Venus. But there was a study that came out, and I may reverse this, but it was about 10 years ago. They were looking at gray matter versus white matter in males and females. And 10 years ago, it looked like females had more white matter and males had more gray matter. And they said, well, that explains it. Females are better at communication. And so the white matters, the fibers, and that's why females are better at communication. Well, a couple of years ago, they redid it, and it turns out females had more gray matter and males had more white matter. And their conclusion was, well, that explains why women are better at communication, because they have more gray matter. So you had your conclusion already. You know, it didn't matter what your results are. You knew what your answer was you wanted to say. They do that a lot because we want to really explain these differences. And so much of it is society. There are truly physiological differences, yes. But a lot of how we expect people to act is due to society. So women communicate better. Maybe there's something biological, you know, the Wernicke's area and the Brokaw's area bigger. Is it bigger because they were bigger to begin with? Is it bigger because we encourage women to speak more? Although men and women speak about the same number of words, women don't talk more. Men talk more, really. So we make some expectations, we make some assumptions about males and females that aren't necessarily true. But on the other hand, we do have to recognize these physiological differences because they have important clinical ramifications of recognizing a heart attack, of how you give a drug, of how you recover from concussion. These are important physiological differences. And with that, I will close it out. Encourage you to see my TED Talk, because then I talk about some of the gender differences and our behavioral differences. But I just didn't have time on this one. So see you on the next video.